Hello and welcome to the Parkinson's Foundation Wellness Wednesdays webinar. I'm Krista Ellis, Community Engagement Manager for the Parkinson's Foundation. Today we will provide a basic overview of Parkinson's disease. We will learn what it is, what causes PD, common symptoms, treatments, and strategies for managing symptoms. Please share in the chat where you're joining from today and say hello to your Parkinson's community. I'm tuning in from the Blue Ridge Mountains of North Carolina. We are recording today's presentation and you will receive a follow-up email from us with a link to the recording and other resources in the coming days. Before we dive into today's topic, I would like to share about the Parkinson's Foundation. The Parkinson's Foundation is a nonprofit focused on bettering the lives of those living with Parkinson's through improving care and advancing research. Everything we do is in close concert with our community to ensure that our actions are aligned with the needs and priorities of those living with and affected by Parkinson's disease. To achieve our mission, we pursue three goals. We focus on improving care for those living with PD, advancing research towards a cure, and empowering our global community. Today's program is an example of one of the things we are doing to help us meet these goals. Today's PD Health at Home program is presented by the Light of Day Foundation. We want to take this moment to thank the Light of Day Foundation for supporting the mission of the Parkinson's Foundation. The Parkinson's Foundation provides weekly education and wellness programs virtually through our PD Health at Home series, which includes Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, our expert briefings with our Chief Scientific Officer, Dr. James Beck, and EP Salud en Casa for our Spanish language community. You can learn more and register for these programs by visiting parkinson.org/pdhealth. As we close announcements, we settle in for our webinar on Parkinson's 101, what you and your family should know. This program will provide a basic overview of Parkinson's disease. This event is intended to approach just the very tip of the iceberg of understanding our journey through Parkinson's. The Parkinson's Foundation offers thousands and such comprehensive information that you can extend your learning at your own self-pace. So please tune into other webinars that the Foundation has if we start to mention something that you have more interest in. I'd like to share a bit about our speaker today. Movement disorders are most effectively treated by adopting a multidisciplinary approach and closely collaborating with the patient, the family, and caregivers. Every member of the clinical team is invaluable in delivering high quality, high value care to patients and their families. Dr. Khemani is the medical director of the Movement Disorders program within the Swedish Neuroscience Institute. The Swedish Neuroscience Institute was recently acknowledged by the Parkinson's Foundation as a comprehensive care center through our global care network for their specialized approach to care and their dedication to their patients. Dr. Khemani, we are so proud of the work and you and your team are doing, and we appreciate you sharing your time with us today.
Thank you, Krista, for that wonderful intro. And I'm thrilled to be here and I'd love to welcome you all to Parkinson's 101. In a little bit, I'll share my PowerPoint presentation and we'll go through the slides. But I am really grateful for you to take a time out of your busy morning and join us here today. And I am very grateful to Parkinson's Foundation for inviting me to present this talk on Parkinson's 101, which truly is a broad overview of Parkinson's disease and its treatment. And as Krista said, there's wonderful webinars on the Parkinson's Foundation website that one can access for more detailed information. So with that, allow me to share my slides and see if that works. It's always interesting how these things go. And let me do it one more time. And Krista, are you able to hear me okay and see the slides okay?
Yes, Dr. Khemani, looks great. Thank you.
Okay, wonderful. So let's get started. The primary objectives of this particular talk are to define Parkinson's disease, to discuss briefly the changes that occur in brains of people with Parkinson's disease, to talk briefly about symptoms of Parkinson's disease, its treatment, and then resources that are available in the community, such as Parkinson's Foundation. What exactly is Parkinson's disease? Parkinson's disease, or Parkinson disease, if you are in the UK, is defined as a progressive neurological neurodegenerative disorder. It affects movement, mood and thinking, and other bodily functions. It is primarily a disorder of the nervous system, but it affects the organs in the body that need the nervous system to function appropriately. Currently, there is no cure for Parkinson's disease, but the symptoms can be treated very effectively with multidisciplinary care. And it's very important to recognize that there is groundbreaking research going on as I speak to understand the mechanism of Parkinson's disease, the cause, and to devise a treatment that can potentially slow down the progression and even stop it. It is also very important to recognize, and I cannot overstate this, that adopting a healthy lifestyle can significantly reduce the burden of Parkinson's disease. So people with Parkinson's disease can live well for many years with expert care, support, and the right resources, and we will see how. Who gets Parkinson's disease? Well, it is estimated that at least 1 million people in the United States have Parkinson's disease, and about 7 to 10 million people worldwide, which is, I believe, an underestimate because statistics are not gathered as diligently as we would like in all countries of the world where Parkinson's is concerned. Parkinson's can affect anyone regardless of race, ethnicity, or gender, but men are more affected than women with a ratio of 3:2. So 3 men to 2 women is the typical ratio that we have seen in Parkinson's disease. Most people are diagnosed when it is older, so it is a disease of advancing age. Typical diagnoses are given around age 60, but in my clinic, I have seen juvenile Parkinson's disease affecting folks at age 18, and then very late onset Parkinson's disease around 90, 95 years of age as well. But it peaks around 60 years of age. A small number of people are much younger. A majority of the people are around the 6th or 7th decade of their life. What are the common signs and symptoms of Parkinson's disease? I think we are all familiar with that tremor at rest, and then complaints of small handwriting, trouble walking due to slowness, a soft voice, a decreased expression, a stooped posture, and then other bodily functions are affected, such as smell, sleeping. The gut doesn't move well, causing constipation. There are blood pressure fluctuations resulting in dizziness or fainting. Not every symptom occurs in everyone to the same extent or degree of severity, and that is very important to recognize. The exact cause that starts Parkinson's in the nervous system is not known, but there are various theories. The primary hypothesis is there are genetic factors which interact with environmental factors and other risk factors which likely predispose to Parkinson's disease. And in individuals, there could be different genes and different environmental factors that they're exposed to. There's a small percentage of people who have one gene when inherited can cause Parkinson's disease, but a majority of the people don't have just one gene that causes Parkinson's disease. We believe that there are mutations or polymorphisms, as we call, in the chromosome throughout the DNA that give rise to the risk of Parkinson's disease, and that's why we believe it's a polygenic risk. Environmental toxins such as rotenone and more recently trichloroethylene are thought to predispose to Parkinson's disease, especially with the prolonged exposure. And then traumatic brain injury, of course, has been shown to be a risk factor. And we have a good example in Muhammad Ali, who had Parkinson's potentially exacerbated by brain trauma from boxing. And older age is a non-modifiable risk factor for Parkinson's disease. What happens in the brains of people with Parkinson's disease is primarily dopamine-producing neurons stop producing dopamine and then gradually die. The mechanism of death of these dopamine neurons is not fully understood. We do believe that an overabundance of a protein called alpha-synuclein in the brain gets misfolded, is toxic to these dopamine neurons, and the spread of this alpha-synuclein protein is one of the reasons why these particular cells are vulnerable to death. And as the disease progresses, the amount of dopamine decreases in the brain. Dopamine is a neurotransmitter, which is a molecule which is responsible for communication or signaling between neurons. It is critical to normal movement. So as dopamine decreases in the brain, this impacts the speed of movement, speech, sleep, cognition, mood, and other bodily functions. It is important to recognize that although dopamine is the primary neurotransmitter that is affected in Parkinson's disease, there are others, including serotonin, acetylcholine, norepinephrine, etc., that are also affected in Parkinson's disease, and that's why we have a myriad of symptoms. The reason Parkinson's disease is called a movement disorder is because its most observable or identifiable symptoms include tremors, slowness of movement, stiffness in muscles, postural problems such as a stooped posture, freezing of gait in certain instances, and falls. These are all symptoms that interfere with normal movement and mobility. But Parkinson's is more than just a movement disorder because it can affect many other systems in the body, which regulate speech, for instance, swallowing, mood and thinking, and bodily functions such as blood pressure, fluctuations, constipation, smell, etc. It is also important to remember that the symptoms vary from person to person, at least in terms of severity and in terms of progression. They usually develop slowly over time. To dive a little deeper into the primary motor symptoms of Parkinson's disease, this slide illustrates the first and the most common observable symptom, which is that classical rest tremor, which occurs in the hand, sometimes in the foot, less likely in the head, neck, or jaw. It is the most recognized symptom, but it is very important to remember that a third of the people with Parkinson's disease may never develop a tremor. So it is important to recognize that Parkinson's disease can occur and be diagnosed without the presence of a rest tremor. What is common to everyone with Parkinson's disease is the fundamental symptom of slowness and trouble with spontaneous movement, which is called bradykinesia. Everyone with Parkinson's disease has bradykinesia without fail. Other symptoms include rigidity or stiffness in arms and legs and the trunk, hips and neck, difficulty with walking and balance, which typically occurs later on in the disease and not in everyone, and then soft speech, Swallowing is affected to some degree, but not to the extent that one cannot eat or drink. It's not like ALS, which progresses very rapidly. Swallowing may be affected in the very latter or the most advanced stages of Parkinson's disease. The non-motor symptoms are very important to recognize because they do cause significant disability if not addressed and treated. The non-motor symptoms that are most commonly encountered in our clinic include problems with mood, such as depression, anxiety, or apathy, that is a lack or loss of interest in things, problems with thinking and memory, such as decreased attention and focus, difficulty with multitasking, slowed thinking and slow responsiveness, difficulty with remembering words, and in a small subset of people, as the disease progresses, it can cause dementia. Other bodily functions that we've been alluding to include problems with sleep. There is REM behavior disorder, which causes acting out of dreams. That can occur several years prior to the onset of the motor symptoms in Parkinson's disease. Insomnia is very common. Parkinson's disease and the medications both can lend to fatigue, sleepiness during the day, decreased energy. As the disease progresses, both the disease and the medications can cause hallucinations and delusions. This is very treatable. It sounds scary, but again, very treatable with the adjustment of medications and the medications that we have for this combination of symptoms, which is called psychosis. And then common bodily functions that are problematic in Parkinson's disease include constipation, bloating, up and down blood pressure fluctuations, and temperature dysregulation. The diagnosis of Parkinson's disease can be made with a high degree of confidence based upon a thorough exam, a medical history, and tests when necessary conducted by a neurologist or a movement disorders neurologist who is experienced in the treatment of Parkinson's disease. A couple tests that are used, but not all the time, to confirm or refute the diagnosis of Parkinson's disease include a dopamine transporter scan called DAT scan, and more recently, a skin biopsy called a SIN1 biopsy. When do you start treatment? In my clinic, I start treatment for Parkinson's disease as soon as I diagnose someone. And this would include medical treatment and non-medical treatment, which we will discuss in just a bit. The goal of treatment is to manage symptoms, but also ensure you're living your fullest life and have the highest quality of life. Treatment is always customized to a person's symptoms and their personal needs. And it is very important to recognize that delaying treatment results in no long-term benefits. And in fact, it may result in accumulation of deficits, which could have otherwise been avoided by prompt treatment. Because Parkinson's disease is both a movement disorder and affects other parts of the body, giving rise to non-motor symptoms, it is very important that care be provided through an integrated, multidisciplinary fashion. The movement disorders neurologist or the general neurologist is important. They quarterback the care, but they need to be supported by other specialists and other medical subspecialties, which include rehabilitation through physical therapists, occupational therapists, speech language pathologists, physiatrists when needed, nurses and nurse practitioners, social workers to help navigate this labyrinthine healthcare system we have in our country, psychiatrists and psychologists to address mental health needs, pharmacists to help the physician avoid medicine interactions, and then neurosurgeons when surgical treatment for Parkinson's disease is considered. The first step is to find the right physician who is trained and an expert in the diagnosis and treatment of Parkinson's disease. And how do you do that? You, of course, talk to your friends and family who may know such a physician, or more easily just call the Parkinson's Foundation, reach out to them, and there is a toll-free number on this slide that can be used to help identify a movement specialist who can help with the diagnosis and treatment of Parkinson's disease. And just like with any other chronic condition, you want to choose a physician who is able to answer your questions effectively, puts you at ease, can build a rapport with you, and of course, treats you respectfully. In terms of the treatment itself, we use a combination approach. The first line treatment for Parkinson's disease is medications, both for motor and non-motor symptoms. When the disease advances, we can explore surgical options, but initially everyone gets treated with medications, and in a little bit we'll see which medications are those. I cannot overstate the importance of exercise and specialized therapies, including physical, occupational, speech therapy, which keep you moving. And this is very important. In fact, it has been recognized that exercise can reduce symptoms of Parkinson's disease significantly and synergistically work with medications to improve quality of life. The most standard medication for the treatment of Parkinson's disease, the most potent medication, remains levodopa decades after it was discovered and it was approved in many countries. Levodopa is usually commercially sold as a combination medication, which includes carbidopa and levodopa. The active component levodopa gets converted to dopamine in the brain, which is that neurotransmitter which is in low supply in Parkinson's disease and which allows or facilitates normal movement. Other medications that look like dopamine but don't need to be converted to dopamine in the brain are dopamine agonists. These medications need to be used with caution, particularly in people over 65 years of age, 70 years of age, because they are prone to more side effects than just levodopa. Two other medications listed on this particular slide include monoamine oxidase B inhibitors, which are known to decrease the breakdown of dopamine in the brain, and COMT inhibitors, which increase the duration of action of levodopa from one dose to the other. There are many other medications that I use in my clinic, and a combination that we don't have time to go through, but I'm sure in future sessions on medications for Parkinson's disease, these will be discussed in detail. Also recognize that this particular lecture is not a prescriptive lecture, it's an informational lecture, so I will not be able to help you with questions about individual medical management. That is something that you'll have to discuss with your treating physicians, but I'm happy to give general advice. How about surgery? As the disease progresses, motor fluctuations can occur. Motor fluctuations is a term that is used for wearing off when the medication doesn't last from one dose to the other. Or when the medication produces dyskinesias or abnormal movement. We try to manage these with medications as best as possible, but sometimes that is not possible. And we reach a point where we need other treatments, such as deep brain stimulation, that can smooth out the motor fluctuations and reduce the amount of medicine we need to control these symptoms. Deep brain stimulation is only reserved for those symptoms that are treated with levodopa. Not everyone is a candidate for deep brain stimulation, but it is very important to have a discussion with your physician as the disease is progressing to determine if DBS is a modality that can help you. There is a therapeutic window that you must observe, because DBS is typically not advised for people who have difficulty with walking or falling or who have dementia. Another surgical treatment is duopa. Duopa involves the insertion of a catheter into the jejunum, which is a part of the small intestine where levodopa is absorbed. This catheter is connected to a pump, which is outside the body, which delivers this carbidopa-levodopa gel directly into the intestine, thus bypassing the gut, which can cause problems with absorption. And again, not everyone's a candidate for duopa, and the selection needs to be done carefully to ensure the best outcomes. Focused ultrasound is the newest kid on the block. It was recently approved by the FDA to treat Parkinson's disease on one side. It is a unilateral treatment currently, and it is best used in people who have a severe tremor on one side or who have dyskinesias that are primarily one-sided. What about other modalities? As I mentioned, exercise is critical to maintain balance, mobility, strength, and flexibility, which are compromised by Parkinson's disease. And exercise may also help with other things such as mood and constipation. Exercise programs should usually be a combination of stretching, aerobic activity, and resistance training. And examples are biking, running, Tai Chi, yoga, Pilates, dance, weight training, non-contact boxing, and Qigong. Whatever you pick, make sure you stick with it and you enjoy it and you're safe and do it sensibly. So it's usually, I send all my patients to a physical therapist who is well-versed with Parkinson's disease, who can design a home exercise program, or HEP, to allow our patients to exercise daily but sensibly, with no injury to their joints and muscles. Nutrition has become recognized as very important in many diseases, including neurodegenerative diseases such as Parkinson's disease. It is critical to stay hydrated because Parkinson's can affect blood pressure, and a lack of fluid in the body can cause a drop in blood pressure. It is also important to stay hydrated to minimize constipation. Foods rich in fiber, such as whole grains, vegetables, and fruits are recommended. And a diet that is based on the Mediterranean diet, which is high in anti-inflammatory and antioxidant foods such as fish, salmon, tuna, dark green leafy vegetables, and colored fruits are recommended in Parkinson's disease. These are also heart-healthy foods. To summarize, in terms of living well with Parkinson's disease, there are a few steps. Number one, determine your goals. Think about what's important to you. Find a Parkinson's expert, and Parkinson's Foundation can help you with that. Find someone to talk to. Isolation, social isolation, emotional isolation can aggravate the symptoms, and it has been proven through scientific evidence that people who are part of a community and have friends and family that they associate with have an overall better quality of life. Create healthy habits, incorporate the healthy lifestyles we talked about, which improve overall quality, but also decrease comorbidities such as heart disease, lung disease, blood pressure, etc., that can add to the burden of Parkinson's disease. And try to be active both mentally and physically. There's a lot of research going on, and we can have 3 or 4 lectures entirely on research in Parkinson's disease, but suffice it to say that the scientists and clinician scientists around the world are actively engaged in discovering treatments to understand the cause of Parkinson's, and also to slow down the progression and perhaps stop it. There is a lot of therapies in the news recently, and they all have to do with anti-alpha-synuclein molecules that can decrease the amount of this protein in the brain. And if you need more information on such research, please access clinicaltrials.gov. The link is on this particular slide, or better yet, just call the Parkinson's Foundation or go to the website for the latest in research. The key takeaways from this particular talk are that Parkinson's disease symptoms can be managed effectively, and they are best managed through multidisciplinary care provided by a neurologist or a movement disorders doctor who is experienced in the treatment of Parkinson's disease. It is important to recognize that you cannot compare and contrast symptoms in Parkinson's disease. Symptoms vary from person to person, and therefore a personalized, customized treatment approach is best to have the best long-term outcomes. And through seminars like this, health literacy in Parkinson's disease empowers patients and caregivers. And this is very important. Before the seminar, we were talking about the amount of information one can put out in one seminar, and it is limited. And there is a reason for that, is that information overload can be problematic. So as Chris just said, this is the tip of the iceberg, an overview in Parkinson's disease. And I'm sure there are going to be experts that are going to be talking about in detail about several of the topics that we touched on in today's lecture. With that, I would like to give a shout out to Parkinson's Foundation. Again, thank you so much for inviting me, and thank you all for sharing your morning with me. These are some of the resources, parkinson.org, and their phone number that you can access for more information. Thank you very much for your attention and time. Appreciate it.
Thank you, Dr. Khemani. Really, really thank you. We have a tremendous amount of participants joining us today from around the world, including India, who have lots of questions about their journey through Parkinson's, and some are quite specific. And I really just want to highlight how you brought awareness to the uniqueness of Parkinson's. Can you talk just a little bit more, just to hit that nail a little bit harder into the piece of wood of how our journey through Parkinson's is quite unique?
Yes, it's unique for many reasons. The age of onset is unique for in everyone. It's not the same, although Parkinson's peaks in the 50s and 60s. We had now begun to recognize that Parkinson's disease in women can present differently. It is a very understudied area. Although women are less affected than men, women metabolize drugs differently. So there was a lot of research to be done in that particular area. With respect to the burden of the disease itself, people with heart disease and cancer who have Parkinson's disease need to be treated differently than people who don't have these comorbidities. So Parkinson's disease can be unique in the sense that it needs to be taken, the treatment needs to be considered in the context of other conditions that people might have. Mm-hmm. And then drugs that work for one set of people or one person may not work for another person for various reasons. The metabolism of drugs in the liver and the brain is also unique from one individual to the other. Having said that, there are some general guidelines that we follow in the treatment, because it has been proven through research that the medical treatments that we have are generalizable to the general population. So it is unique, but there are some general principles we utilize to treat everyone.
Thank you for bringing some more conversation about the approach to our unique individuals and also as a community affected by Parkinson's. One thing my time working in clinic that I feel recently or newly diagnosed in the journey of exploring Parkinson's disease was the approach to treatments. Can you just elaborate a little bit on sort of this, I wouldn't call it a roller coaster, but there is this ebb and flow of trying a certain amount of medication, pulling back, trying a different amount to find what works best for our unique bodies?
Well, if there is one singular theme in the treatment of Parkinson's disease, it is the utilization of levodopa. Mm-hmm. In a majority of the people, when dosed correctly, it is very effective and it treats symptoms very effectively overall. But in a small number of patients, it can cause nausea, it can be quite intolerable. But even in those individuals, my experience has been, if you go low and very slow, the brain and body get accustomed to levodopa, and people realize benefits over a long period of time. So it is critical to understand that the the effective treatment of Parkinson's disease is almost impossible without the gold standard, which is carbidopa-levodopa. So if there's one singular theme, I would like everyone to remember that. And the whole point about delaying treatment with levodopa, that levodopa is toxic, and because levodopa causes dyskinesias, we shouldn't use it, etc., etc. These myths have been debunked so many times over that it's almost become moot to talk about the importance of levodopa in the treatment of Parkinson's disease. So that's number one. Getting that out of the way, the other medications are basically selected based upon age, stage, other comorbidities, and cost effectiveness. There are lots of new medications on the market, but new is not always equal to better. This is important to recognize. There are some tested and true medications that can be beneficial throughout the lifespan of someone with Parkinson's disease. And when they're not, then we shift to the newer medications, which may have a different mechanism of action, which may have a better side effect profile. But cost effectiveness needs to be kept in mind. If you can't afford the medication, there's no point in prescribing it. And unfortunately, in our healthcare system, every insurance company has its own rules and regulations on whether they will approve a medication or not. Having said that, everyone approves carbidopa-levodopa. So that's important to recognize. And then in terms of uniqueness, as I said earlier, surgical treatments are great for advanced Parkinson's disease, but not everyone is a candidate. And there are different surgical treatments for different individuals. And therefore, we've got deep brain stimulation, we got duopa, we got focused ultrasound, and now hopefully in the near future, we may have that subcutaneous carbidopa-levodopa pump that has been in development for some time. And so there are other treatments that are also being developed so that the treatment can be customized from one individual to another.
Great. Thank you for sharing that, Dr. Khemani. Whether you're recently diagnosed or living in a more advanced stage of Parkinson's disease, is there something that is essential for ensuring a good quality of life in living with PD?
Yes, knowledge, very important. Exactly what we are doing today is aligning yourself with organizations such as Parkinsons.org and empowering yourself with knowledge so that you can, with the help of your physician, be part of a community that can give you information, the most latest information on medications and treatment and research. So to be up to date is one of the most important things that anyone can do with Parkinson's disease. Exactly what we are doing. And then there are other things we talked about which is again can be uniform and can be a singular theme in addition to levodopa, is that whole exercise bit, the importance of staying active, picking an exercise that you like and moving, which is so important for the longevity of our joints and brain and cardiac system, etc. So those are the couple things that I'd say that are fairly universal in the treatment of Parkinson's disease.
This is a question that I know is a pattern that continues to come up in thinking of how can I manage the best quality of life? What's the best exercise to do when living with Parkinson's?
There isn't one. The exercises also needs to be customized to the patient. For instance, someone with Parkinson's disease who has rheumatoid arthritis, we don't expect them to run on the treadmill if their joints are hurting. So they may need to do low impact exercises. You know, for someone who has a cardiac compromise and congestive heart failure, we don't expect them to do a lot of aerobics. We need to get cardiac clearance and device and exercise strategy for them. So the exercises for Parkinson's disease need to take into consideration not just Parkinson's disease, but what other conditions the patients have, because it requires, you know, your total body to be involved. And sometimes that may not be possible because of arthritis, because of other medical conditions. So therefore, there is no one best exercise. The most amount of research is done on cardiac or aerobic exercise. And there is a suggestion that vigorous or medium vigorous exercise, either on a bicycle or treadmill, can reduce symptoms a lot and help form brain connections, etc. But that doesn't mean other exercises are not beneficial. So please customize the exercise routine to what suits your body, doesn't cause injury, and what you can sustain for the long duration.
Dr. Khemani, I intentionally try to offer the why. So why does exercise help us in our management of Parkinson's disease?
It works in many ways. Blood flow is important, and good blood flow ensures good oxygenation. One theory is exercise improves blood flow, not just to the brain, but to the other organs of the system. Mm-hmm. Our blood also carries nutrients and medications, etc. So it's just commonsensical that when you increase blood flow to the brain, you are by far trying to improve the delivery of the medications you're taking for Parkinson's disease. Sluggish blood flow would not be preferred because you want the medications to enter the blood and basically be beneficial. So that's one way: nutrients, oxygens, medicines, and then heart healthy. We do know that improving or increasing blood flow, improving cardiac output is helpful from a cardiac standpoint, and not just the brain standpoint. So a healthy heart and a healthy brain actually go hand in hand. It's important to recognize. At the molecular level, exercise allows the release of certain molecules such as BDNF, GDNF, molecules that you can't take by mouth. These molecules nourish the neurons. And it has been shown, at least in animal studies, that animals who are exercised in the lab form neural connections, neural synapses, maybe even sprout new neurons. And in Parkinson's disease, that would be advisable because we have these neurons that are dopamine neurons that are dying. So any treatment or any intervention that improves that neuronal reserve or increases the numbers of cells and synapses is highly recommended. So there are various ways in which exercise is quite beneficial with or without Parkinson's disease, truly.
I guess I will take my evening tonight and get to the gym. Thanks, Dr. Khemani. Let's see. So Diane asks us, and this is a question that I know a lot of our community is impacted by: low blood pressure and the correlation with Parkinson's disease, whether it is the Parkinson's or is it the drugs or is it another comorbidity that we're trying to consider in the treatment of the whole unit?
First and foremost, it is Parkinson's disease. Parkinson's disease causes autonomic dysregulation, which is a fancy term for affecting systems in the body that control blood pressure, that regulate sleep, breathing, and the gut, bladder, etc. And specific to blood pressure, unfortunately, Parkinson's disease affects the release of a neurotransmitter called norepinephrine, and that's in short supply. And when we don't have enough norepinephrine, our blood pressure can fall, particularly when you're standing or when you're exercising. And unfortunately, the medications to treat Parkinson's disease can make that worse. Now, a lot of people with Parkinson's disease are also taking other medications, blood pressure medications, anticholinergics, which can drop the blood pressure further. So when we hear of lightheadedness or dizziness in Parkinson's disease, we look at the entire picture. First, can we eliminate medications that are causing the drop in blood pressure? Is that possible, including high blood pressure pills, which may not be needed? Is the person drinking enough water? Are they getting enough electrolytes? These non-pharmacological interventions, some exercises to mitigate a low blood pressure, maybe not eating large meals. So there was an entire lecture or two on treatment of low blood pressure. And then finally, we have medications that can raise the blood pressure on standing. But these medications need to be used judiciously because they can raise the blood pressure to dangerous levels as well. So we tell patients to raise the head of their bed by 6 to 9 inches, etc. when we are treating low blood pressure. It's an art and a science to treat low blood pressure.
Thank you, Dr. Khemani. We had a inquiry from Richard, who's joining us today, and he says, my children believe I've received a death sentence. And can you just address this as you know, life expectancy, and perhaps inspire some hope in living with Parkinson's?
Yes, the diagnosis can be heavy, but in the modern day and age, the longevity of someone with Parkinson's disease with good multidisciplinary care is almost as good as someone without Parkinson's disease, save a couple years. So I've got in my clinic, I mean, it's full of people who are 80, 85, 90, living with Parkinson's disease and actually thriving with it. So just based on my observation, it is not a death sentence. Now, death is inevitable with or without Parkinson's disease. When it happens is not under our control. What I like to focus on in my patients is how do you live your life to the fullest, regardless of what you have? Because I deal with other conditions such as that are more rapidly progressive, multiple system atrophy, PSP, etc., that can mimic Parkinson's, but are even worse diagnoses because they can progress rapidly and there is no treatment for it. But with Parkinson's disease and multidisciplinary care, we have testimonials from patients who are doing really well. So I would definitely encourage his children to reach out to the Parkinson's Foundation and see how we can improve Richard's quality of life.
Thank you. One of the early symptoms or signs of Parkinson's disease is experiencing constipation, changes in our bowels. We've gotten multiple inquiries about, let's talk about constipation, the bowels, thinking about how these changes occur in Parkinson's disease. Would you just touch on this early sign or indicator of Parkinson's disease a little bit more?
Yes, the bowel or the gut is regulated by something called the enteric nervous system. And that is the third arm of the nervous system. There is the autonomic nervous system, and enteric nervous system is part of that. It is almost like the brain of the gut. It's fairly under autonomous control, although the brain interacts with the enteric nervous system to move the bowel. In Parkinson's disease, what happens is the enteric nervous system starts to degenerate. And then the enteric nervous system consists of nerve cells that make the bowel move. And hence, we have constipation when the bowel is not moving really well. And that can precede a brain dysfunction by many years. And one suggestion is perhaps Parkinson's disease starts in the gut or in the enteric nervous system of the gut. In addition to constipation, because of the slow gut or a gastroparesis, which is slow emptying of the stomach, there is a change in the bacterial flora or the genome in the gut. That is the microbial system. So upwards of billions and billions of good bacteria and other microorganisms live in the gut. In Parkinson's disease, the balance of good versus bad is affected. And then there's an overabundance of certain microbes that cause problems in Parkinson's disease. How that actually happens is not entirely known, but the hypothesis is the neuronal dysfunction or the problems with the enteric nervous system, which give rise to the slow gut, are the same is the same issue that causes this change in microbes or in that gut microbiota, if you will. So therefore, treatment of constipation includes increasing fluids, fibers, but also taking probiotics to improve the flora of the gut. And this is a hot area of research to see if we actually improve that microbiome of the gut, in addition to improving constipation, can we actually improve the overall quality of life? Will other symptoms improve, such as motor symptoms? We're not there yet, but that's a very active area of research.
Thank you for bringing light to that, Dr. Khemani. I'm going to plug my team, Jenny and Laura. We have an expert briefing coming up on the gut-brain connection, and we can really dive deeper into this topic. So if Jenny or Laura, if you could find that link for our expert briefing that's coming up and share it in the chat with our community here. Dr. Khemani, this is an ongoing conversation. It's a hot topic, if not one of the most impactful ones that I've witnessed in our community, talking about mood changes and Parkinson's disease. So Sandy asks us, do you have suggestions on how to improve mood that doesn't interact with carbidopa-levodopa?
Yes. First of all, the mood needs to be assessed to determine what's the severity of the mood issue. Is it depression? Is it anxiety? Is it both? Something else going on? And then a good conversation needs to be had with the patient about multidisciplinary treatment for mood. Non-pharmacological therapies include a proper sleep, removal of external stressors and anxiety, which is not always possible, but some attempt needs to be made, and counseling. And this is very important to recognize. It's very underutilized because, unfortunately, it's not well paid for. But we are hoping that with the new light that has been shone on mental health, the importance of mental health and the importance of the importance of insurance companies to pay for mental health like they do for physical health, that might change. In fact, mental health is physical health and vice versa. That's the way we look at it. And so counseling becomes really important. None of that interact with carbidopa-levodopa. But even simple antidepressants can be given very effectively that do not interact with carbidopa-levodopa and do not cause an exacerbation of symptoms. So mood is very treatable and should be addressed because it impacts quality of life.
You mentioned another key feature, I'll say, of Parkinson's disease is sleep. And I believe if my knowledge serves me right, that's also an indication, changes in sleep pattern, an early sign of Parkinson's disease. Can you talk a little bit more about the changes in sleep and perhaps how we can improve our sleep while we're living with Parkinson's?
Yes, one of the most common findings in people with Parkinson's disease and in people with Parkinson's disease years before they have been diagnosed is this sleep disorder called REM behavior disorder, in which the person acts their dreams out, talks or moves about and thrashes, and can inadvertently hurt their bed partner or fall out of bed. That's one of the most dramatic sleep disorders, but the most common sleep disorder is insomnia, which is an inability to fall asleep or an inability to maintain sleep, which is early morning awakening. In fact, it is probably the most common sleep disorder in the world, with or without Parkinson's disease. So those are two sleep disorders that we see. There's also obstructive sleep apnea and restless leg syndrome. So sleep and Parkinson's disease is yet another couple hours of conversations that we can have. And it needs to be addressed effectively, first by identifying what is the sleep problem. The REM behavior disorder has a different treatment than insomnia, which has a different treatment than obstructive sleep apnea, which has a different treatment than restless leg syndrome.
And the Parkinson's Foundation has recorded and archived webinars on sleep and Parkinson's, all entire pages dedicated to understanding the relationship of sleep and Parkinson's disease. So please reach out to our helpline or start browsing the depths of our web pages. We have just a few minutes left, Dr. Khemani. I'd like to ask just one more question, as this is something that continues to arise as we continue to host these Parkinson's 101. And in recent surveys, just looking over what the community's asking the foundation to present on in coming webinars is pain. Is pain related to Parkinson's disease? Is it just us aging and these bodies that we reside in? Or, is it something that is directly related to our Parkinson's?
Yes, very common. With or without Parkinson's, pain is universal. But in Parkinson's, studies have shown that the perception of pain can be exacerbated. We don't know why. There is a rewiring or a change that takes place in the brain that the same amount of pain that is caused in someone with Parkinson's disease is heightened or perceived differently than in someone without Parkinson's disease. Quantifying pain becomes problematic. It's very hard to do, but there is a way to do it, and science has shown that. And in Parkinson's disease, pain can occur due to the most common things that people have: joint problems, arthritis, neuropathies, and discomfort due to restless legs, and radiculopathy and musculoskeletal issues, which are not directly linked to Parkinson's disease, but can exist or coexist with Parkinson's disease. From Parkinson's disease itself, a severe tremor, which is not treated, can really destabilize joints. And I've seen people talking about fatigue and discomfort from constantly shaking. That's problematic. Severe dyskinesias can cause pain, and that's treatable. Dystonia is another condition that can occur in Parkinson's disease, which is a turning or twisting of the arm or the leg or the neck, which can cause pain. So pain is ubiquitous in Parkinson's disease, but again, the cause of pain needs to be identified. And once the cause of pain is identified, it can be really treated well.
Thank you, Dr. Khemani. As we step into closing announcements, are there any final remarks, comments, or words that you'd like to share with the community?
Well, first, I'd like to thank you and Parkinson's Foundation for having me on. Really an honor and a privilege to be talking to you all about Parkinson's disease, and thanking the audience for such wonderful and insightful questions. And I just want to encourage all the members of the audience to align themselves with Parkinson's Foundation and access your website for more information, and empower yourself with information. And so, yeah, that's probably the most important thing you can do.
So on behalf of all of us at the Parkinson's Foundation, Dr. Khemani, we are, just very proud to be supporting you and your team and the work that you're doing in the community. And just thank you for sharing the time. I know that you have a book of patients that really, really appreciate the work that you do and the type of care that you offer. So I know firsthand, I've spoken to some patients, I've read reviews that your patients really admire you. So I think that your essence really comes through in the knowledge and passion that you hold for the community. So thank you so much for being here today.
Well, thank you. We really cherish our patients and their families over here. Thank you all, and have a wonderful week.
I want to thank all of you for joining us today. You did something really marvelous by choosing to show up and learn more and take this power of this tool of knowledge, as Dr. Khemani kept alluding to, learning more at our own self-pace. So thank you all for joining us today. A follow-up email will be sent with a survey. Please tell us what you thought about today's program, and know that you will receive a link to today's presentation with additional resources. My team and I will take time to look through the questions that we were not able to answer to provide resources to you through that post-event email. If you had a question today that was not answered, you can't seem to find it on our webpage, or you want to talk to someone, reach out to our helpline by calling 1-800-4PD-INFO. You can also email our helpline at helpline@parkinson.org. You can use that same contact information to find and order free resources such as educational books, our hospital safety kit, fact sheets on topics such as intimacy, nutrition, medical marijuana, anything that you might be interested in learning more about to help you manage your Parkinson's disease. We've got it. We thank you for joining us today, and I hope to see you in the Zoom land again soon. Bye for now.